Next of all, we have another one of my heroes. I told you I was going to keep saying this. I'm like a fanboy at Comic-Con right now. This is amazing. Dr. Michael Rich is an associate professor at Harvard Medical School and Harvard School of Public Health. He is the founder and director of the Center on Media and Child Health at Boston Children's Hospital. Dr. Rich draws on the scientific evidence about the powerful positive and negative effects of media to advise pediatricians and parents how to use media in ways that optimize child development. He is a member of the Massachusetts chapter of the American Academy of Pediatrics and another member of the Council on Communications and Media. Dr. Rich is a recipient of the AAP's Halvard Sherry Award and also is the author of numerous AAP policy statements. And I'm going to add in here also has a history in film writing and production. So he is a star in many ways. Let's give a warm welcome to Dr. Rich.
Presuming that this is what makes it tick. There we go. Hello. We have work to do. When we started looking at the effects of media on kids, and it was quite a long time ago, this is what we were worried about. It was, as my father would say, does TV make kids fat, stupid, and violent? But these are the kids we're taking care of today. They're no longer sitting on the couch watching the television. Indeed, they've been using media since they were born. So, to go back to one of my mentors and many of yours, either directly or indirectly, Thierry Brazelton, who wrote in 1974 about his concern about the effects of television on kids. And he said at that time, I'm certainly not suggesting that we eliminate television altogether. This kind of active participation on the part of the parent as well as the child may begin to make television the valuable experience it should be. And so to extend that into the future, we need to think about how we can use these media in ways that can be valuable and not harmful. So the question that was raised by Dr. Brazelton began to be answered by researchers not only in pediatrics and public health, but in psychology and education and communication and many other disciplines. And we were finding links with violence, with obesity, with learning, with sleep, sexual behavior, disordered eating, smoking, risk-taking, alcohol and other drugs, and connectedness. There's an evidence base for what we do, but remember that we're also learning through all of this. And we have been honored today by having members from Sesame Workshop here who have done phenomenal work over a generation using research to build the kind of media that teaches kids to learn better, not only cognitively, but social emotionally. So we gathered up this research together and put together a number of policy statements, including this one, lead authored by Margie Hogan, back in 1991. And what happened to us? We got smacked in the face. This is the only time, as far as I know, that the Academy has made it to the front page above the fold of the New York Times. But what happened is that we got painted with a broad brush of anti-media. We hate media. No media before the age of 2. Only 2 hours, screen time limits. And what they didn't hear under these was what drove those recommendations. But we also need to learn from this also, which is that we need to not be restrictive and prescriptive, but advising and nurturing the parents and children we serve. And we need to control the message as it's rolled out to the rest of the world as well. So let's go back and look at what killed kids 100 years ago. Infectious diseases, birth defects, cancer. As physicians, we could do nothing about any of those. But when we looked at the environments in which they were living, we were able to make dramatic changes and to change those outcomes. Today, the leading causes of death are now injury, homicide, and suicide. So one thing I will suggest is that we need to start looking not at television and Snapchat and the iPad as vectors of harm or of education, but as the environment in which these kids are living, and use environmental health concepts for dealing with these issues. We still have to breathe our air. We still have to drink the water. Let's work on finding the air and the water that is most drinkable, and let's control our drinking of it and focus it. One of the things that we need to do, and this was mentioned earlier today in one of the sessions, is instead of cross-sectional studies that look at children at one point in time and say, well, violent kids are using violent media, that means the media causes it, or maybe violent kids are attracted to violent media, we need to do prospective longitudinal studies. We need to look at what children are doing with media and what their health outcomes. And I'm talking physical, mental, and social health. Not only that, but we have to recognize that we're dealing with not one, but two moving targets. We've got the moving target of the child, growing, changing, developing. We've got the moving target of the changing landscape of media. And so, in my practice, I'm seeing kids who are 2 years apart in the same family who have two entirely different media diets, two entirely different media experiences. We need to be nimble and we need to respond to these. We have to have focused outcomes. We have to understand that different children are differently susceptible. Some kids can play Grand Theft Auto all day long and not have a problem with it. Other kids will. And understanding that all screens are not equal. This is a mistake that, quite honestly, we made extrapolating from the television data to all screens. One of the great things about the new policies released today is that they acknowledge that all screens are not equal. What's happening? Oh, I'm pushing the wrong button, sorry. Okay, okay. In May of 2014, this academy convened a group of researchers from many different disciplines, at least 12, and from around the world who have been looking at the issue, the interface between media and children, the media they use and how they use them and how it affects them. And these findings and these new collaborations have informed these policies that have been issued today. We need to understand that media are so much our environment, so much every aspect of our lives, that we need other disciplines to teach us and to give us their perspectives on this and to bring this together, because we're after taking care of the whole child. A poll from earlier this year by Common Sense Media found that half of all teens and over a quarter of parents feel addicted to their devices, that 41% of teens and more than 3/4 of the parents feel that the other is distracted when they're talking to them, and that 72% of teens and 48% of parents feel that they need to respond immediately to any signal that comes to them. And I would argue that as we have gained connectivity, we have lost connectedness with each other. We don't look at each other. We don't listen to each other. We don't touch each other. So I want to talk very briefly. You're going to hear a lot of good research from my colleagues that follow me, but I want to talk very briefly about two new conditions that we're seeing. And the first is distracted parenting. 73% of parents say they use devices while eating with their children. And during that time, they have 20% fewer verbal and 39% fewer nonverbal interactions with them. And the ones that they have are, shut up and eat. You know, I'm annoyed that you're in on my tweet. You're interrupting my tweet. This is not just restricted to the dining room. This is in the playgrounds too. 30% of the time parents are with children in playgrounds are looking at devices. And during that time, their children were greater than 3 times more likely to take risks. So we have a new phenomenon here, which I'm calling distracted parenting. We talk about distracted driving. Parenting is arguably the most important and lasting job we ever do. Let's put our devices down. Another one that is brought up by that poll is there such a thing as internet addiction disorder? And in Asia, colleagues in Korea, in China, in Taiwan are dealing with huge numbers of kids who they're finding are using excessively, have increasing tolerance to their use of electronic media, have withdrawal symptoms when they're away from them, and have negative consequences. This, as a diagnosis, has been in discussion since the mid-1990s. And in the current issue, the DSM-5, it is still decided that we don't have enough evidence about it. They put it all together in a diagnosis that they're calling internet gaming disorder. But this is not a recognized diagnosis because they also determine that there's not enough data yet to determine it. But I am seeing personally more and more young people with this as a chief complaint. And what's interesting is I'm not convinced that this is a monolithic problem. I'm seeing kids who have gaming problems on or off the internet. I'm seeing kids who have social media issues, and there's not much overlap between them. Kids who are on pornography and kids who are information seekers, the kids who are watching endless YouTube videos and crawling around in Wikipedia. What I'm also seeing is that in every case that we have seen so far, there is an underlying diagnosis that we already know of attention deficit disorder, of anxiety, of depression, of oppositional defiant disorder. And both as a practical reason, because we cannot bill for internet addiction disorder, and I want to be able to have these kids come back to care, I would suggest that we look for these underlying diagnoses and make those diagnoses and care for them. And in fact, because of that, we have struck down both the internet addiction disorder and the internet gaming disorder because it's not limited to the internet and it's not limited to gaming. And we're actually calling it problematic interactive media use, or PIMU, which is something I like because you can actually write it in ancient Greek. But what I'm doing here is saying that this may not be a problem that is new. It may be problems we already know playing themselves out in this new environment. And not only that, but we need to be able to treat these kids and take care of them. And if we can give them a diagnosis that's already established, they're going to keep coming to care. I did it again. So I'm offering to all of you the resources online from the Center on Media and Child Health. We do 3 things. We investigate, we do the research, we collate the research. We have a database of research of over 15,000 articles from around the world that you can search yourself or get our help in searching. We translate those data into information that can educate and empower children and their families, and we innovate with media tools to develop media tools that enhance and support children's health. Investigation, we're doing a study across the province of Alberta following 3,000 children, as long as the money will hold out, but certainly for many, many years, using a smartphone app that does ecological momentary assessment and follows them through their day and covers all the media they're exposed to. And we go back to them year after year for a whole host of health outcomes. And are finding some interesting things. So first data from it show that kids are more fatigued, more distracted, and more anxious than they were even 5 years ago. And they attribute that to their use of the personal media. And a word of warning, you may be contacted soon because we are actually going to be rolling out momentarily a pediatric healthcare providers media use survey, not just to pediatricians, but to NPs, to social workers, to any psychologists, anybody who works with children, to see what they know about media use, to what they do in their own homes, and what they advise to their patients. We translate this. Some of you already know about Ask the Mediatrician, the online advice column for raising digital natives, but this is an attempt to follow that moving target. Our policies are good, but they are set in stone and they last for a long time. And frankly, things change all the time, and we need to be responsive to what's happening. And so we try to answer questions from parents, from children, that are based in the research, that are balanced, not finger-wagging or telling them they're wrong, but practical and able to do right at home, right now. And finally, we innovate using media tools like social media. This is a closed social media environment for young people that have young people with celiac disease. And they are able to connect with each other with visual illness narratives, talking to their own phones, their own selfies, healthy selfies, if you will, talking about how they solve problems in their lives, how they support each other. And the amazing thing that happens is not only does this increase all of their health literacy, but for many of them who feel isolated by their illness, they have a community, they have people who understand what they're saying and what they're going through. And not only can they mentor others, but be mentored, but they can mentor others, which is hugely therapeutic. So finally, this is a call for all of us to evidence-based action, to understand how media affect child health and development, both positively and negatively, to recognize healthy and problematic use in our patients and our families, to advise them by giving practical everyday advice on how to use healthy and media in healthy ways, and how to avoid problematic media use. And we need to follow up. We need to stay with them as they move through these media-saturated environments, follow up on identified media-related problems, and provide anticipatory guidance at each of those critical visits, particularly early in life, about how the media can be used and should be used at that age. We need to change the frame that we've had. We've had a values-based frame. This is bad, this is good. We need to change from values to optimizing health and development, to rephrase from talking about appropriate use to optimal use. And we need to advocate for investment not in restrictions on producers, but on research and education. And contrary to what you may believe, I'm not saying wrong. Sorry. Hopefully in about a month, we're going to have a very child-friendly president. Part of the policies that are being released today are accompanied by a parent toolkit, which is available online from the AAP. But here's the other piece. We need a toolkit. We're the ones who are saying, I know media is really, really important in my kid's life, but how can I do it in the 7 or 10 or 15 minutes that I have to do immunizations and nutrition and growth and bicycle helmets, et cetera? So we have put together a clinician toolkit of tools, informations, and strategies so we can integrate media health into primary care practice rather than doing it as an add-on. And this includes how-to videos about how to incorporate it into your visit. It has ages and stages, has developmental stages and the media issues that are apparent in that age group. And it has different tip sheets around various health outcomes. And these are all things that are available on our website for you to use. And I would very much appreciate any and all feedback so we can keep getting it better, because remember, we are chasing moving targets of growing children and changing media. and we're all in this together. Thank you. We should mention that the QR code.
You could probably get that QR. Oh, we just lost it.
We just lost it.
Can we get that last slide back at all? Is there maybe?
If you have a smartphone and you shoot the QR code, it'll take you right to our clinician site.
Thank you very much. You can